Hey everyone, I'm the president of the IUSSP. My name is Tom Legrand. The IUSSP is the International Union for the Scientific Study of Population, and I'm thrilled to welcome you to the webinar on digital and computational approaches to study determinants and consequences of the spread of COVID-19. As several of the participants today are not IUSSP members, I'm just going to take a couple minutes briefly to present the IUSSP and our activities. I'll then pass the microphone on to Mary Ellen Zupin, the IUSSP Executive Director, who will explain how this webinar will work. And then on to Emilio Zegeni, Director of the Max Planck Institute for Demographic Research, who organized this session, this webinar, and who will run the show. The IUSSP is the World Association of Population Scientists and Demographers. As such, we organize an international population conference once every 4 years. The next one will take place in Hyderabad, India, next year in December 2021. We support the work of roughly 20 thematic scientific panels that run both on-site and cyber research seminars, organize training workshops to develop research capacity, focusing to a fair extent on low-income countries, and they run research fellowship programs and other activities. We publish the NIUSSP web online news magazine that targets both scientists and the broader public. We develop activities to inform policy, mostly at international levels. We've given several statements to the United Nations, major commissions in recent years. And we collaborate with regional population associations on a variety of issues. As is the case of most other scientific and professional associations, most of our activities have moved online this year, and today's event is part of our new webinar series. In recent years, many of our activities have focused on innovative data and empirical methods, areas in which demographers have traditionally excelled. Excuse me. We have 3 scientific panels working in this area: digital demography, run by Emilio Zegeni, who's organized this webinar, and Francisco Bellari. Population perspectives and demographic methods to strengthen civil registration and vital statistics systems, and the Population Environment Research Network that works on the analysis of spatial data. In addition, we have a Data Revolution working group supported by the Hewlett Foundation that has organized a series of activities, including, over the last couple of years, international meetings on advancing small area estimation using Bayesian statistical methods, and on innovations to structured data collection methods, data collection through questionnaires and other more structured forms. This year, our work has increasingly focused on the COVID-19 epidemic. We now have a web page of resource links on the IUSSP website on demographers' contributions to understanding the COVID-19 pandemic. We're in the process of setting up 2 new scientific panels on the topic. And several of our webinars have dealt directly with aspects of the pandemic, the one today, and we have 2 more by the end of July. On July 17th, there will be a webinar on quantifying COVID-19 related excess mortality in Latin America, demographic analyses of death registration data. And on July 29th, the COVID-19 pandemic consequences for adolescents. To end, I'd just like to invite everyone here to take a look at the IUSSP website, especially if you aren't a member of the IUSSP and you aren't getting regular emails from us, to see details on all of these activities and for notification of upcoming seminars. Mary Ellen, I'll pass the microphone on to you now.
Hi, everyone. I'm going to give you some tips on how we're going to run things for this webinar, in particular, how we're going to do the question and answers for the discussion at the end. Today's format is going to be 7 short lightning presentations, followed approximately by 30 minutes of discussion, where speakers will respond to the questions that you submitted in the Q&A, and where some of you may even be given the microphone to ask your question or make a comment. For the Q&A to be a success, we need your collaboration. Please note to only use the Q&A feature to submit questions for speakers. Don't use the chat for this purpose. Your chats, if you put your question there, they won't be answered. The Q&A feature is located, I think, in the center bottom of your screen. When you click it open, you might need to push it to the side of your screen so that you can see the presentations or the speakers. And you should type your questions there. To make this interactive, what we ask you to do is that One is if your question is for well, one, you can write your questions while the speakers are speaking. So don't wait until the Q&A session at the end. If the question is for a specific speaker, please include the speaker's name in your question. Speakers will try, if they have time, to respond in writing to your specific questions. Everyone will be able to see the responses that have been written. Other questions will be addressed at the end during the Q&A and discussion period. And of course, there may not be time to address all questions. I think right now we have 135 attendees and over 300 people who registered. So we're expecting a crowd. Given the large number of attendees, we need you to help us crowdsource the best questions that should be answered. And you can do this by giving a thumbs up to questions that you find particularly interesting or compelling that you'd like to see an answer to. We also ask that, that you thumbs up a question rather than add your own new question if it's similar. So because when you thumb up a question, it moves it to the top of the queue, it's more likely to be answered. But if we have lots of same questions that are the same, we don't know which one's the most popular. So the idea is before you type in your question, scroll down, look at some of the other questions. If there's one that's not similar, add your own. If there's one that's very similar to yours, just give it a thumbs up. Maybe add a comment to if you want a little bit more specificity, and we'll go from there. And this will really help us, I think, make this an engaging discussion at the end. We're also going to try and allow a few people from the audience to speak or ask questions or make comments orally. If you'd like to speak, please indicate this by using the raised hand symbol that's, I think, on your side panel somewhere. I don't have the same screen as you do. And if time allows and you are selected to speak, please note that you need to keep your question, your comment under 1 minute. If you go over, we'll just mute you. We know it's rude, but we'll have to do that just to allow for enough time. And finally, after this session ends, after the webinar, could you kindly respond to the survey to let us know how things went? There'll be a quick one that'll ask you to give the seminar or the webinar a thumbs up or a thumbs down, but you'll also get a link to a questionnaire online that'll allow you to give us a little bit more information on how things went. And we'd also like you to share with us if you had any technical problems joining. By technical problems, I mean with your audio, with the visual, or with your internet connectivity, and to tell us where you were joining us from, so we kind of get an idea of what countries or areas of the world might have difficulties with connectivity. So now, I want to thank you all for being here, and I'm going to turn this over to Emilio Zagani and the panel of speakers, and I'm looking forward to the rest of this webinar. Okay, Emilio.
Okay, thank you, Mary Ellen. Welcome everyone to this IUSSP webinar on digital and computational approaches to study determinants and consequences of the spread of COVID-19. My name is Emilio Zagani. I am director of the Max Planck Institute for Demography Research, where I head the Lab of Digital and Computational Demography. But today I'm here in my role as co-chair of the IUSSP panel on digital demography. This panel builds on the work of its predecessor, the IUSSP panel on big data and population processes, which ran from 2015 to 2018. The new panel on digital demography aims at consolidating the field of digital demography and at promoting exchange and collaboration between demographers, computer scientists, and sociologists. This new panel will expand the scope of the previous one by promoting not only the use of digital trace data for demographic purposes, but also by improving our understanding of the implications of the digitalization of life for health, well-being, and demographic behavior among others. Now, for this specific webinar, we would like to discuss what digital and computational approaches can reveal about the relationships between three key pillars of demographic research, that is mortality, fertility, and geographic mobility, and the spread of COVID-19. This webinar is organized around three main interrelated themes. The first part is about new forms of data collections that are enabled by social media and in particular by Facebook. So for this first part, there will be two talks. The first one will be given by Nadia Diamond-Smith, who is an assistant professor of epidemiology and biostatistics at the University of California at San Francisco. She's a public health demographer with expertise in maternal and child health in developing world. And she will discuss a new type of data collection for India. This talk will be followed by a talk by Jorge Cimentada, who is a research scientist at the Max Planck Institute for Demography Research. He is a sociologist by training, but with a strong computational bent. He will discuss new forms of data collection for Europe and the US. Now, the second part of the webinar will then include two talks that are related to issues of trust and misinformation. The first one will be given by Yelena Mejova, who is a senior research scientist at the ISI Foundation in Turin, in Italy, and she's part of the digital epidemiology group there. She's a computer scientist by training, and her work focuses on the use of social media in health informatics, mostly, or broadly described. Second talk for the second part will be given by Riddhi Kashyap, who is an associate professor of social demographer at Nuffield College at Oxford University. Among others, Riddhi is interested in how digital and computational innovations and new types of data sources that include digital trace data can contribute to social science. The third part of the webinar is about studying geographic mobility and its implications for COVID-19, including mortality. There we have three speakers. The first one will be Michele Tizzoni, who is a senior research scientist at the ISI Foundation. He holds a PhD in physics, and broadly speaking, he is interested in the application of new technologies to the field of epidemiology and public health. The second presentation will be given by Ingmar Weber, who is the research director for social computing at the Qatar Computing Research Institute. He is a computer scientist by training with a strong bent towards demographic and social science research. And finally, Ugo Filippo Basellini is a research scientist at the Max Planck Institute for Demography Research. He is a formal demographer by training with expertise in the field of mortality and health inequality. Now, these lightning talks are intended to provide, on the one hand, an overview of current research projects at the intersection of digital demography and COVID-19. But they're most importantly intended to whet your appetite for stimulating conversations. So I really do hope that all of you will contribute to make this event a real forum for exchange. And I invite you to be active listeners as well as to post comments, questions, and suggestions throughout this webinar. Now, without any further delay, I'm going to give the floor to the first speaker for today, who is Nadia Diamond-Smith, who is going to present her work on Facebook ads for panel data in the era of COVID-19.
Great. Good morning, everyone from California. So I'm going to talk about some data we've been collecting in India, and I just want to acknowledge my collaborators both in India and in the US. So the objectives of this research were to understand the impact of COVID-19 on reproductive health in India. As happened globally, a very strict lockdown started in India in about the middle of March, and we quickly saw media reports in India, as well as we've been seeing globally, wondering, is COVID going to lead to a baby boom? And also things like this, which is from a pharmacy delivery store in India, saying that they'd had this huge number of people delivering pregnancy kits, requesting pregnancy kits and family planning. So we wanted to know what's really going on. So again, we wanted to understand the impact of COVID-19 and especially the lockdown on maternal and reproductive health care access and use, and also look at things like the impact on fertility decision-making. Do people want to have a baby more, less, timing, exposure to violence, mental health outcomes, the economic impacts? And we wanted to collect data from both men and women to look at both the gendered impacts, because both men and women play a part in reproductive decision-making. And we were hoping to look at the changes over time, because even back in March, we thought this lockdown and how it looks will change over the next few months. So we thought that given our Facebook ads might pose a potential way to collect data, survey data. So we wanted to collect bilingual data using in both Hindi and English survey data for 4 months. And our idea was that we would try to recruit a panel using Facebook ads with a survey that people could click on. And then we would follow up with those people every month for 4 months. We weren't sure if that would work. So we thought that each month we would also send out a new set of surveys using Facebook ads and collect cross-sectional data each month as well. The only incentive was a raffle for people who completed all 4 months of the survey for an iPad mini. And the only eligibility criteria was stating that you were over 18. So we sent out the first round of surveys using ads like this. This is just a sample of some of the ones that we use. We wanted to collect a diverse population. And it was both Facebook and Instagram, I should say. And the first round went out on April 14th, and we did it broadly. And then we sent it out again, specifically targeting women of reproductive age, because that was a main interest of the study. So here's a little bit about our findings. So we can see here from that round one data, that round one survey, which was sent out on April 14th, about 1.5% of people who saw the ads clicked on it. 23% of those people started the survey, and about 40% completed it. And I should say that this survey had about 20-ish questions. Then a month later, again, about 1.5% of people who saw it clicked on it, but a much lower percent of people began the survey, only 0.7% of those. Similar percent who started it completed it. In terms of our panel, we got about 5,000 people who gave us their email in the first round. Only 11% of them started the survey when we emailed it to them again a month later, but most of them completed it. Round three, which happened just a few weeks ago, again, about 1.5% of people who saw it clicked on it. Again, a very low percent of people who clicked on it began the survey. And our round three panel was also pretty low, with only about 5% of people who'd originally given us their emails completing the round three survey. So why might this be the case? We have some ideas. We got really excited after the first round, and we're like, oh, so many people answered our survey. Maybe we can add more questions. So it was a slightly longer survey. We changed the data collection platform, although I don't think that this probably made too much of an impact. Most likely this is timing related. Maybe COVID stopped being quite as interesting to people after it had been going on for a longer time. People adjusted to lockdown, didn't have as much time on their hands to answer surveys. There were some changes to what exactly was happening with the lockdown in India over this time period, and some of our data collection points aligned right with when lockdown was changing, so that might have impacted behavior. Quickly, because I think people are very interested in the representativeness. You know, when we first did this, I thought that we were going to get mostly young, rich, urban people, and to a certain extent that is true. We oversampled, so this is showing our sample versus all of India. We definitely oversampled young people, but there is still a distribution of people across the age groups. We got much fewer rural people than all of India, although I was impressed that about a third of the samples said that they were from living in rural areas. And this is all, of course, identified, self-identified. And we oversampled the north, but again, given that we didn't do any targeting or anything, we did get some distribution across India and across income. A little bit about our findings, but this is showing the change between the first round in April and the most recent round in June. About most recently in June, 71% of people said that they faced a barrier to general health care because of COVID. 45% of pregnant women or recently delivered women said that they faced a barrier because of COVID to accessing care. 67% of people seeking abortion care faced a barrier, and about 32% of people seeking family planning care. And these are some of the reasons that people listed for each of those. In terms of some other indicators people might be interested in, this is from the most recent round three data. You can see that just under a half of people said that their current money situation, they either had to cut back or they were not able to manage. And about a third of people had some level of food insecurity. We were also interested in substance abuse during this time. And interestingly, more people reported that they either had a decreased alcohol consumption or tobacco consumption during this time period. probably because of lack of access due to stores being closed. Although by the time of round 3, there was some opening up of shops in India. Some other outcomes, this first we can see the impact on income. And the biggest impact seems to have been, and right away in April, and then a decrease in people reporting that they had lost income due to COVID-19. And in terms of mental health, we can see that the biggest impact sort of seemed to be after the lockdown had been going on for about 2 months. So there was slightly more people reporting some mental health, feeling low, depressed, or helpless in the last 2 weeks in that middle round than in the first or the third one. We did ask about testing for COVID-19, and there was not a big change over time in terms of the % of people who said that they had been tested. So what are our next steps, or what summary? It does seem like Facebook ads recruited a large and more diverse than I would have expected sample of people, but it is biased. And it seems like it might not be as an effective an approach for recruiting a panel. This might be particularly true in a setting like India, where I think social media is much more frequently used than something like email. So maybe a different way of getting back in touch with the panel participants might be more successful. Moving forward, we're planning to apply sample weights based on a comparison of our population to nationally representative survey data, look at trends over time. We're going to collect more data, look at some subpopulations. We might do some targeted in-depth interviews, and then of course, look at the gendered effects of COVID-19. Thank you very much. And again, just to acknowledge my collaborators.
Thank you very much, Nadia, for this very interesting presentation. We'll continue this conversation about Facebook surveys with the next talk by Jorge Cimentada. We just move geographically from India to Europe and the US. So the next speaker is Jorge Cimentada, who's going to talk about can we trust social media surveys, insights from a dynamic COVID survey.
All right. Hello, everyone from Rostock, Germany. Today, I want to present some of the work that we've been doing at the Max Planck Institute related to COVID. So beginning March 13th, we were very interested in sort of grabbing the current situation or understanding the current situation of COVID by sampling the populations in the US and 7 European countries. And we wanted to get a general idea about the health status of respondents, their behavior, social contacts, and their attitudes. And so this was a very interesting survey because right now the survey is currently live and it's still running. And we have over 125,000 answers at the moment. Now, the nice thing about this is we did it through Facebook, and it literally took us less than 3 weeks to plan the survey. Now, when I tell this to all of my social science peers, they will all tell me immediately, okay, great, but I don't trust whatever you're doing because there's a strong level of self-selection, right? So your sample is completely biased and I really don't trust anything that you're doing. And I like that mindset, right? It's supposed to be a critical mindset towards sort of these new tools. What we tried to do in this survey to sort of correct for these problems is we took advantage of Facebook's advertisement sort of stratification, right? So we took, for example, a given country, we took a given region, then we took a given age group, and then we took a given gender, and we sort of exposed them to the ads of our survey. People then clicked on the ad and we took them to our survey. Now, this is a good property, which is that in Europe, we have high quality data that we can sort of create weights from. So we can actually get the true proportion of people within each of these stratums and re-weight them using true population counts from Eurostat. Now, does it work? So from our results, this, for example, the light blue has the unweighted Facebook proportions of males and females. The dark blue has the weighted proportions of Facebook users. And the red line has the weighted proportions from the European Social Survey, which is sort of like our comparison of whether we're on the right track. And you can see that after we reweight, the actual proportions of female, which were overrepresented, are now going much more closer to the actual proportion. So this weighting scheme seems to have worked for sort of rebalancing the female and male sort of proportions. Now, this is not a perfect tool. So we stratified by age groups, and we were also able to generate weights by age groups. And you can see, for example, here that for younger populations, we had an overrepresentation of younger populations, but we were able to sort of re-weight them down to closer to the true proportion. Now, this is more difficult for the older people, but again, since we have a comparison with the European Social Survey, we can assess how wrong we are at this point. And I think this is the key takeaway from this type of study. Now, we were able to stratify our ads by gender and age, but we weren't able to stratify by education. And so you can see that the survey is actually still biased. So we do have differences. For example, we have an overrepresentation of educated people in the education variable. And so it's not an easy fix, but it's something that seems to have some promising results. Now, again, we need to embrace the uncertainty of these tools, because the advantage is that we can produce a very, very good survey in a very short amount of time and get a lot of respondents. Now, for example, for Germany, for education, we don't really need to even correct for weighting. It seems that the distribution of education on Facebook matches very closely the actual proportion of the true population. So it really depends on the context, but these type of post-stratification techniques seem to have a promising sort of landscape for doing Facebook surveys. So many social scientists and journals still see this social media research with suspicion, and that is fine, okay? But we need to communicate better that this type of research does not replace traditional surveys. And in fact, it would be very difficult, because the aims of general surveys are very broad and they actually require random samples. Social media surveys are actually excellent for doing particular research questions, right? They are quicker, they are cheaper. They can allow us to reallocate budget on hard to reach groups dynamically as the survey is happening. We can assess how wrong we are, and we can sort of exploit techniques such as post-stratification on how we can sort of improve the representativeness. Of course, there's a trade-off between having fine-grained stratums, such as the one that we have, and having accuracy with weights. So for example, we could make some of our stratums much more aggregated, and we could fill them out really quickly with a Facebook surveys. But again, we compromise the accuracy of the weights. So there's a trade-off between these two things. Now, what we need for truly doing Facebook surveys is to understand much more the difference between Facebook users and non-Facebook users. If we understand the variables that self-select people into Facebook, that would be sort of like the big step to help us understand whether we can achieve sort of important research with Facebook that is representative. If you'd like to know more about our research, here's my great team of collaborators, and you can visit this link here for some conclusions about our results. Thank you very much.
Thank you, Jorge, for the nice presentation. So this concludes the very first part of our discussion about sort of Facebook surveys and their advantages and disadvantages. If in the audience you have questions, feel free to write in the question and answers, and Jorge and Nadia will try to address them in writing now and potentially later at the end during the discussion part orally. Now we move to the second part on sort of trust and misinformation. There, the first talk that's going to be given is from Riddhi Kashyap on reliance on scientists and experts during the COVID-19 outbreak in Italy.
Excellent. Thanks very much, Emilio, for inviting me to this panel. And I'm very excited to be speaking with such an exciting group of researchers. Good afternoon from Oxford to all the attendees. The work that I'll be presenting today is done with two collaborators, Pietro Battiston from the University of Parma and my colleague at Oxford, Valentina Rotondi. Can I be heard? Okay. So I want to start off by saying that we can't escape the fact that we're living in unprecedented times. We're in the midst of a global pandemic, and it's everywhere in the news, and there's a lot of information out there. So who do we turn to for information in this time of a public health crisis? And how do we respond to the guidance and the information that we receive, in particular from scientists and experts? So these are the questions that motivate our project that I'm going to be presenting today. So surveys across the world show us that people in general tend to trust scientists and they tend to trust science. And this is a good thing because we live in highly specialized, complex societies, and there's a lot of specialized knowledge that's needed. And especially in situations such as the onset of a new infectious disease, a lot of expertise is needed, and we need people to adapt health behaviors and change their behaviors quite rapidly, even when the immediate implications of those changes aren't visible to them. So we need people to rely on scientific advice and scientific expertise that is provided to them. So the question that motivates us is, how does public reliance and responsiveness to scientists and experts for information shift in the context of an epidemic? And in this particular case, the COVID-19 outbreak in Italy is where we looked at some of these questions. So coming at this, their hypotheses are in some sense ambiguous. So the literature tells us that on one hand, a shared external threat could increase reliance on experts and on science because we're vulnerable, we don't know what to do. But on the other hand, the fact that we are facing a new external unknown threat could also result in people reacting with suspicion and skepticism. There's limited empirical evidence out there on what exactly happens during an epidemic, in part because data collection, when there are new kinds of restrictions like lockdowns, are difficult to conduct, right? So there's challenges associated with rapid data collection, and doing a very detailed survey to look at population health behaviors and modifications are hard to do in these kinds of settings. So what we tried to do was we used digital trace data from Twitter and data from 2 pre-registered surveys, including the second, which had a survey experiment, which we collected online, to analyze some of these dynamics of reliance in information seeking on scientists and experts. In the first part of our study, we looked at retweets of scientists and health authorities by following the 3 sort of, we created a Twitter sample which was hashtag defined, and we looked at essentially who were the most mentioned different categories of Twitter accounts that were most mentioned in the COVID-19 Twitter dialogue that was happening in Italy. And then we looked at, among these different categories, what were the sort of temporal dynamics on who was retweeted. We fielded a continuous survey in 4 waves on a popular app, Telegram, in the COVID-19 channel, asking people who they were seeking information from. So this was a bot that just essentially released this survey, and we got over nearly 10,000 responses. This was over 4 weeks, and the first survey was launched about 5 days after the first case was detected in Italy. So very early on in the whole outbreak. And then we had the subsequent waves go on until the end of March. And then the third part, we had a survey experiment where we geographically targeted using Facebook ads in the same kind of platform that, that both Nadia and Jorge talked about. And like we followed the approach that Jorge was talking about by using post-stratification weights to sort of make our sample, which was biased across demographic characteristics, a bit more representative. Our key treatment in the survey experiment was simply this. We asked people a question on a scale of 0 to 10, how much do you agree with the following statement? And we asked health-related facts, which were widely available on public health agencies' websites, both in Italy and the WHO. So in this case, are younger people also at risk of contracting the coronavirus? Then we provided them information about that particular question. And in this case, we just randomized whether that information was explicitly stated as coming from public health experts, here as reported by the Italian Institute of Public Health. And a random group, the other half, essentially got the same information without a source. And then we gave them the same question again and asked them, how much do you want to change your beliefs? And we asked 4 separate questions, health-related publicly available facts from public health agencies, which are listed on the screen. So just to briefly summarize some of our findings, On Twitter, we found essentially that retweeting of both scientists and health authorities followed a kind of curvilinear path. We first saw initial increases followed by a declining tendency. On Telegram, we saw similar patterns. We saw that on Telegram, we also saw a curvilinear path. First, increasing responsiveness and reliance on scientists and health authorities. Everyone wanted information from them, but then it started going down again. And on the survey experiment, interestingly, which was fielded at the same time that we were detecting a downward trend, both in Twitter and Telegram, we found that when people were given information and it was told as coming from public health experts, either it was no different, or they even showed a weaker willingness to, or a lower willingness to update their beliefs when it was told as coming explicitly from public health experts than when the source was not identified. So to conclude, we found interesting patterns at the midst of the onset of this new epidemic in the Italian context of reliance on scientists and public health officials or authorities as following a sort of curvilinear path. We saw initial increases followed by weakening responsiveness and a slowdown in information seeking from health authorities. And we found that those holding incorrect beliefs actually gave no greater or even lower importance to information when it came from experts, or it was stated as coming from public health experts. And in this analysis, we looked at whether weakened trust in public health authorities with prolonged exposure to the disease was a potential mechanism. And some of our findings do indeed suggest that that is a mechanism for why we detected the weakened responsiveness. We hope we're planning to field more surveys as the pandemic goes on in July, August, and then later on in the year to see if some of these mechanisms continue to hold. And I look forward to your questions. Thank you.
Thank you, Eli, for your fascinating talk. Now we move to Yelena Mejova, who is giving a presentation that is complementary in a way to the one that Givi just gave. And Yelena Mejova is going to talk about COVID-19 on Facebook ads, competing agendas around the public health crisis.
Yes, hello. Let's see, how do I share my screen?
At the bottom.
There we go, yeah. Okay. Q&A goes away. Very good. All right. Well, thank you so much for inviting me to this very interesting panel. It's been a crazy time and very interesting things have been going on. So let me tell you about some of the things we've been doing here at the ISI Foundation. And especially we've been looking at messaging, advertising in particular on Facebook that is competing with public health messaging on this platform. And this was work done jointly with Kireki Kalimeri here. Let's see. Okay, so here we're using this very interesting new data source, a Facebook ads library. And anybody can go to it and basically search for the ads that were shown on Facebook. Basically, I think within a year and a half from now. And especially they are focusing on social issues, elections, and politics. So you can search for some keyword or an advertiser and you get back all the ads that have mentioned it. And they even provide some kind of statistics about the money spent on the ad and who saw it, which is very interesting. And you don't have to do this by hand. You can also use the API that they provide and download this information automatically. So what we did was, this was fairly early in the pandemic, on February 20th, we searched for coronavirus and COVID-19, and we actually looked at all the countries, so you can see how the volume is picking up. So we found just under 1,000 ads already mentioning the virus, and here we in particular looked at the USA. So some of the interesting, most interesting thing that I think this library provides is the breakdown of the audience reached in terms of demographics, age and gender, and geography. This in US at state level. So we can glimpse some inequalities, like having fewer men who see public health or nonprofit ads, or older users across pretty much all of the ads. Or we can look at geography, and we find that there is really state-specific focus, which often falls on California, Texas, New York, and others, which means that the campaigns are by far not reaching the US population uniformly. So they're highly focused. So finally, it's not really clear to us whether these biases come from the advertisers themselves, how they set up their ads, or from the nature of their audience, whether it's just easier to reach these people, or by some mechanism internally to Facebook by how they distribute these ads. So this is a very interesting question. Next, we can look at the kind of ads that we've seen. So, for example, public health ads tended to be informational, and as well as showing some personal stories, like you can see here. It was very popular. Nonprofits tended to focus on donation drives and animal welfare, and especially on animal markets like the one in Wuhan. The news articles often provided a general overview of the situation and notified public of new cases. So although some of them were quite politically charged, and they sometimes provided a critique of China's handling of the pandemic, and similarly, there was a criticism of China even from the political pages or political advertisers. So at that point, the US political, so presidential election primaries were going on. So there was a lot of posting on that front. And it was interesting to see that it came from both sides of the political divide. So here you see two examples, one kind of opposing and another supporting or criticizing and supporting Donald Trump. So most business ads came from financial advisors and insurers, and they focused on the performance of the markets during this crisis and whether one could get insurance plan that would cover the coronavirus treatment, which is an unfortunate thing that people have to care about in US. There were also some enterprising businesses that were advertising their inventory that may be difficult to find around that time. So finally, we found some ads that had questionable information. So for example, this one you see here is full of conspiracy theories, folk remedies, and frankly, it looks like it was written by a bot. But there was all kinds of other material that was insinuating, for example, that China was designing the virus and unleashing it purposefully. Others that were criticizing Donald Trump, and yet others who were trying to sell masks and other wear without any health statements. So general observations that we found from this data was that there were numerous parties that were competing with public health messaging and potentially outspending them in the viewership bidding war. That the lack of vetting may have resulted in misinformation or speculative information being promoted on Facebook, and that using this epidemic to emphasize political divisions instead of uniting the public may have put additional stress on the response. And finally, that there was a really narrow targeting that may mean that this information may not reach people evenly, so which may introduce some potential disagreement about different populations in the US. So thank you so much for your attention, and you can download the paper online, and I'm looking forward to the discussion.
Thank you, Yelena, for this very interesting presentation and for showing this new type of data from the Facebook ads library. Now, I just want to remind the people who are attending that if you have some questions, especially clarifications or small questions, feel free to post them on the Q&A, and the speakers will try to address them if it's feasible to address them in writing. Otherwise, we will try to discuss them later at the end. So now we move to the third part that is more about geographic mobility. In general, geographic mobility and its implications for COVID-19, and geographic mobility and its implication for mortality. We have three speakers here. The first speaker is going to be Michele Tizzoni from the ISI Foundation, who's going to talk about measuring mobility changes in Italy during the COVID-19 outbreak with mobile phone data.
Thank you, Emilio, for the introduction, and thank you, everyone, for listening and for the invitation. So today I'm going to present a project I've been busy with since the beginning of the pandemic in Italy, that is measuring mobility changes in Italy with mobile phone data. This is a project that have been working on with some collaborators at the ISI Foundation in Italy, where I work, and with Brennan Lake and Filippo Privitera work at Cubic, a location intelligence company, and we also released a preprint describing the early results of this work in March 2020. So since mid-March of this year, we have been publishing periodic reports on this website that we call the COVID-19 Mobility Monitoring Project, providing a periodic assessment how the mobility of Italians changed during the COVID-19 outbreak in response to the non-pharmaceutical interventions, the public health interventions that were issued by the government to mitigate and try to contain the spread of the outbreak. We have been working using a data set that contains stops, so locations of about 167,000 de-identified smartphone users in Italy. That is data provided by Cubic. The data set starts January 18, 2020, and it spans now all the period until June, and the type of unit we have been processing in this work. It's the form of anonymous hashed user ID, the time of a position of the user, and latitude and longitude. And typically the accuracy that is taken from GPS ranges in the 100 meters for this type of data. It's important to mention here that we have been working using anonymized and de-identified data of users who have opted in to provide access to the location anonymously through a GDPR compliant framework. And users can opt out at any time during the period. So it actually, it happens quite often that users get out of the panel. And we never single out identifiable individuals. Never we try to link this data to third-party data. And differently from the type of data that we have seen in the previous presentation, we have no demographic information available about the users. So we don't know anything about them, and importantly, we have no health information available. So we never try to understand or to infer the health condition of a user, try to link this with his or her mobility status. So to get an idea of the timeline of the outbreak in Italy, so we have data for ranging from January 18 until the February 21st, 22nd, when the first outbreak was reported in Italy. And this is the pre-outbreak period. So we compute a number of metrics and we consider this period our baseline. And then we see changes in end of February and March induced by all the interventions that are shown in this map, in this chart, the school closure, stay-at-home order, and then the national lockdown on March 12 in the subsequent weeks. And then we use the pre-outbreak period as a baseline to compare and to understand how mobility changed. We also checked for the representativeness of our data set. So we can see that at the province level in Italy, the fraction of users who live in a certain province, it correlates well with the fraction of census population reported by census in Italy, although northern provinces, provinces of northern Italy are overrepresented, while southern and the islands, southern provinces are typically underrepresented in our sample. And then from the raw data, we extract the three main mobility metrics. So one is the origin destination matrix, a daily OD matrix that basically counts the number of users traveling between different provinces in Italy, which gives a sense of the long range mobility, how long range mobility changed during the outbreak. Then we compute the radius of gyration, which is a common metric used in mobile phone studies that gives an idea of the spatial range of individual movements. And we measure the median and average radius of gyration of all users who live in a certain province. And finally, we compute a spatial proximity network. So we computed the average degree of a network that is built by looking at intersecting circles of fixed radius drawn around all the positions of different users over a day. So that basically gives an idea of the possibility of people to meet during a day, and of the closeness of how many people can meet over, how many users can meet over one day. And we monitor the evolution of these three quantities over time during the time span I've just mentioned. And for instance, here I just show for sake of shortness the time evolution of the daily average degree of the proximity network that I just mentioned from the beginning of February until mid-June. And this is divided by geographic areas, so the north, center, and south of Italy. We can see as vertical black lines that correspond to the major events, major restrictions that were imposed during the outbreak, and while the two lines on the right indicate the lift of the restrictions. So on the 4th of May, the lockdown was eased, and then in early June, all travel was possible again through different provinces. But what we learn here basically is that we can see a very quick reduction of the average degree of the network in the north. That was the epicenter of the epidemic when the first outbreak sparked in Italy. That was later followed by the center and the south that were with a significant drop, of course, during the lockdown. Once the restrictions were eased, actually the recovery, it was quite slow. And basically until the mid-June, we were still not at the baseline levels yet, so that were not reached. So it was a very slow increase in the mobility and the proximity. Here we are not looking at long range mobility again, but only at close proximity. So even if restrictions were eased, it took quite some weeks to get back to baseline levels. There are observable quick weekly patterns that remain over the course of the lockdown, and of course are due to the people that were still working even during the lockdown period. An important point is that we made the data available, and actually just today we got our data descriptor published in Scientific Data. So you can look for this paper, COVID-19 Outbreak Response, a data set to assess mobility changes in Italy following national lockdown, in Scientific Data, and a Figshare link where we have shared the metrics that I've just described with data updated until April 17. And we are going to update soon on another repository on the Humanitarian Data Exchange, the same data set with a longer time span until the end of June 2020. As an outlook, I think the COVID-19 pandemic has opened a new era in digital epidemiology, and it's been possible now to measure for the first time behavioral responses to an epidemic using this type of digital traces and connect them to global individual features. There are many challenges ahead of us in this sense, ethical challenges, the fact that data are biased, are skewed, and also the fact that this type of data sharing require a strong collaboration effort between industry, the academic, and the governments. As an opportunity from a more theoretical point of view is that this data can be used to create a new generation of models of behavioral changes during the epidemic. And I thank you for your attentions, and I look forward to the discussions, and thank also the supporters of the work, and here are my contacts for if anybody has further questions. Thank you.
Okay, thank you, Michele, for this very relevant presentation. And it's great to see that the data are also available to anybody who want to use them now after your publication in Scientific Data. Now we switch from cell phone data to Google data. The next presentation is given by Ingmar Weber on using live information from Google Maps to monitor mobility trends.
Yeah, hello everybody. Thanks a lot for the opportunity to present this this work. I think this is even more experimental than some of the other work you've seen. So I'd love to hear any sort of feedback and suggestions on where sort of to take this. So what type of data are we using for this work? So here I'm showing some data that's actually been collected for me, myself. So if I go to this sort of website, Google.com Maps timeline, it shows me where I was on February 12th, right? It shows me I was, you can sort of see, I was first at a location called home, and then I was at a location called work. Then I went back home, right? So this is in Doha, Qatar, right? So somehow Google knows and, logs sort of where I go. And so why do I let Google, do this sort of, right? So I've opted into sharing my location to Google, so to have a number of benefits, right? So these include, I'm quoting from Google's website, personalized maps, real-time traffic, and other things. And also just personally, I find it fun to sort of to see then, just there are some sort of statistics where I can see where I was in 2017 or places that I've visited, right? But point here is I'm opting in to share my data with Google. So how is Google using this data? So one of the things that Google is using this data for is for live visits. So here I'm showing a particular a petrol station in Bogota, Colombia. So this is one of the cities that we are collecting this type of data for. And in the bottom left, you will see that Google provides live information, right? As of that particular moment, when I sort of took this screenshot, it shows not too busy overall. And the pink bar is the sort of live visits as of that moment. And the blue bar is sort of historic information, right? So like a historical Tuesday night, or I guess typically would already be Wednesday morning, at that particular hour, there was not too much sort of traffic at this petrol station, but there was certainly a lot more than historically expected. And I'll get back to this sort of, sort of petrol station at night observation later, right? So again, here the points, you have this sort of not too busy, but also you have it compared to historical data. And yeah, Google says that this is based on visits to this place. The type of data, it sort of comes from people like myself who share data with Google. So the relative baseline is based over the last few months. So this is sort of the data in blue, and this is all normalized for a particular place. So the data would be normalized such that for any given one place, the maximum bar in blue would have a value of 100, similar to Google Trends if you've used that sort of type data before. So you can't really compare across places, but you can compare within a given place across time. So, okay, so then, once we sort of found this data, we went ahead and sort of collected it. So first we identified a list of locations on Google Maps. Then we looked for those that have live information, and we collected data. If you're interested in this data, I'd be happy to help you collect this data yourself. And then it's just a matter of sort of parsing the data that's returned, etc. And so here I want to give a big shout out to people at QTI, in particular to Chun Gyo, Nan, Rade, Nura, and Ji for helping, with the data collection, also for putting together online data visualizations that we have. So here I will just show a screenshot of one. I will later give you a list of others. I will also share those in the chat later. So here I'm showing a data visualization for Bogota in Colombia. So what do you see here? So here I've zoomed in to information about the particular airport in Bogota, where it sort of compares on this particular day. So this was June 23rd, which I believe was a Tuesday. The sort of the typical visits to this airport are in blue, and the actually observed on that particular Tuesday are shown in red or sort of pink, right? And you can sort of see there's quite a lot less expected than sort of historically expected visits to the airport on that particular given day. On the right, you have this for all the locations in Bogota where we have live information on that particular day, where the color compares observed versus historic information. So points marked in red would be that on that day there was actually more visits than historically expected on a Tuesday, and then sort of the darkest green would be less than 40% of the historic volume, and then you have sort of other shades in between. Here, just sort of what can you do with this data? Again, we also have this sort of similar data for Milan. So this is in Italy. Here I've selected the whole month of May, where again, I'm now just sort of speculating, but there might be like a sort of temporal. I mean, so now I've only selected supermarkets. So what you see here are only data for sort of supermarkets in May, where there also seems to be some sort of geographical pattern going on, right? Where maybe in this closest to the city center, there's the biggest drop over historic baselines, but on the sort of outskirts of the city there, maybe there's not quite as much as a drop, or even potential like an increase over historic baseline, right? So you can do a very, very sort of fine-grained sort of sub-city analysis with this data. So what are we doing with this data? So actually, so far we haven't really used it much for research, but I'd love to hear, also thoughts from people in the audience or sort of or so. But we've used it, it's being used operationally in Qatar by the Ministry of Public Health to sort of look at, sort of stay-at-home orders and if those are being followed. One of the things that we've observed is shifts in when supermarkets are being visited, sort of so that people now sort of seems to be flattened out a bit, sort of whereas usually there was a big peak in the evening in Qatar, also partly related to the heat. And now there's the morning bump is a bit higher than it used to be sort of historically. We've also seen a shift in people apparently doing shopping at petrol stations, in particular at night. So for petrol stations, there are now more visits at night, like at 1 a.m. or 2 a.m. than historically expected. And that seems to do not to fill up their car, but actually to do sort of shopping, because these have like small grocery stores attached. And so people, sort of seem to go there for sort of social distancing. It's also being part of Nigeria's official coronavirus geospatial data hub. So if you search for that, you would see them linking to our data visualization for Lagos in that case. And also data for Nairobi is being explored by an NGO to monitor curfew compliance. Some of the limitations of this data, of course, bias, different types of bias. So first is the type of location that provide this data in the first place. And so these are only highly popular places, right? Because if it's only like a very, very small place, then any visit could maybe be linked to an individual sort of person, right? So you will not find live information for your corner store on Google Maps. So these are fairly popular places. Furthermore, there are certain types of location, even though there is a lot of traffic, but Google does not provide it because it's too sensitive. These are in particular sort of a lot of hospitals and other sort of health-related facilities. And then of course it's the users who contribute this. Like who are people like me? Like why would people sort of opt into this, right? So these are probably biases towards Android users in particular. And there are some black box issues, right? We don't know exactly how sort of Google assigns you to a particular location, etc. And also once in a while, like they update their historic reference. Sort of. So we've seen one such update in June, I think 8th or sort of, where there was in particular a lot of places stopped providing this information, probably because they sort of no longer passed the sort of anonymity threshold in terms of having enough visits. So now there are fewer places providing this information than about a month ago. And then one of the challenges actually we had is that this is almost too local, like too hyper local, that like sometimes it's easier to communicate this data at a slightly higher aggregate level, and also a lot of the ground truth that you might want to use is not at the particular location level, sort of a service, like maybe at a neighborhood level, or even at the city level, sort of. So in some cases almost too fine-grained to be easily usable for some cases. I will share these links also in the chat later, but just to show you some of the cities that we have publicly available dashboards, out there. If there's a particular city that's of interest to you, get in touch and we could sort of see if we can spin up another data collection for a city that's of interest to you. Yeah, and if you have any questions, please get in touch later by email or through the Q&A feature. Thank you very much.
Thank you very much, Ingmar, for presenting the new type of data. Now we move to the last presentation that's going to link these types of data with mortality. So the last presentation is going to be given by Ugo Filippo Badellini, who is going to talk about leveraging Google mobility reports to assess the effects of non-pharmaceutical interventions on excess mortality in England and Wales.
Thank you very much, Emilio. Oh, did I unmute myself? Yes. Thank you very much, Emilio, for the invitation. It's been really interesting so far to hear all the ways in which digital data can help us to study the COVID pandemic. And now I will provide another example of this, looking at one aspect that we still didn't touch upon during this webinar, that is mortality. And I want to acknowledge my co-authors from the Max Planck Institute for Demographic Research, from INED, and from Bocconi University. So just a bit of background. We have seen several different non-pharmaceutical interventions being carried out throughout the globe in order to try and contain the spread of COVID-19. The goal of this paper is try to assess whether these measures have been successful in reducing the mortality burden from the disease. In order to do this, we will study the relationship between excess mortality and human mobility, leveraging digital data sources. In particular, we will focus at the regional level in England and Wales. Let me present you the mortality data that we will analyze. This is excess mortality rate in England and Wales, weekly data from beginning of 2015 to 2020. This is the excess mortality, which is basically the number, is the difference between the observed and the expected number of deaths standardized by the population. So what we can see is that during COVID-19, there has been a big spike of mortality, of course, of death counts, which resulted in an increase in the excess mortality rate. This is true not only at the aggregate level in England and Wales, but across all the regions in England and Wales. So for the 10 regions, we can see a big spike in the excess mortality rate. Next, in terms of mobility data, we will use some data from Google, similar to the one that Ingmar introduced. These are Google community mobility reports, which report the percentage, the relative change in mobility in some given categories with respect to the beginning of the year. So for example, for England and Wales, here we have workplaces on the left-hand side and stay-at-home, time spent at home on the right-hand side. And we can see how in the first weeks for which data is available, that is week 8 to 11, which is February, basically, middle of February, there was not a big change with respect to the beginning of the year. However, after the introduction of two non-pharmaceutical measures, which is the social distancing first, and then the encouragement, and then the enforcement of the lockdown, this measure responded quite rapidly. And they stayed, so we had a reduction in the visit to workplaces and then increase in the time spent at home. And you can see that following in the following weeks of 2020, these values reached a minimum or maximum, a minimum reduction and a maximum increase. And then they started to slowly going back to the levels at the beginning of the year. So what we want to, again, this is true for England and Wales in general, but in regions, in all the regions, we see more or less the same pattern with different levels. This is for stay-at-home measures, and this is for workplace visits. So what we want to do now is we want to assess whether there is any relationship between mortality, excess mortality rate, and time spent at home. We anticipate that change in mobility would not have an immediate effect on mortality. And this is because changes in mobility would first influence the number of contacts in the population. A decreased number of contacts would then hopefully bring forward a reduction in the number of infections. And afterwards, this would lead to hopefully a reduction in the number of deaths. So what we study is the relationship between the excess mortality at time t with respect to previous values of changes in mobility. Here is, for example, in time spent at home, and for example, leg 1 means that we will look at time spent at home 1 week before, leg of 2 means time spent at home 2 weeks before, and so on. So when we look at this, we see that the correlation between the two variables changes from positive to negative. And after a leg of 5 weeks, we see that increases in time spent at home is negatively correlated with the excess mortality rate, meaning more time spent at home is correlated to a reduction in excess mortality. The same is true on the opposite side, with the opposite sign for a visit to workplaces. So after a lag of 5 weeks, we see that the more visit to the workplaces, the more the excess mortality, so a positive correlation. What we do then is we investigate whether these correlations are significant in a regression setting. So we run linear mixed effect regressions where we have dependent variable, the excess mortality rate, and as a covariate, the mobility indicator, but we also control for the time trend of the pandemic and for the different regional effects using some random intercept. And we find our results show that the signs on the coefficients of the mobility indicators are as expected from the correlation, and the coefficients are different, 95% confidence interval are different from 0. So just to conclude, when we consider a lag of 5 or more weeks, we find a strong negative correlation between excess mortality and time spent at home, and a positive correlation with outdoor mobility. These results are also confirmed in a regression setting that accounts for the pandemic time trend and regional differences. And finally, with this model, we estimate that about 130,000 excess deaths have been averted by the increased time spent at home following the non-pharmaceutical measures in England and Wales. Thank you for your attention, and I look forward to the discussion.
Thank you very much, Ugo. It's now time to move to the discussion. So right now, I see that many of the questions have been addressed in writing. And if people have questions, this is a good time to sort of post your questions on the Q&A chat. In the meanwhile, I would like to ask a general question to Nadia and to Jorge about their surveys. So I see that some of the technical questions have been addressed in the Q&A section, in the written Q&A section, but I have a sort of broader question. So for example, there is some interest, there's a lot of interest in the Q&A chat on developing countries. In developing countries, the demographic and health surveys are the main source of demographic information that we have. And so here you presented some new types of data collection. And so I'm wondering whether you envision that these new types of data collection, potentially calibrated with the DHS, might give us some insights into what's happening in developing countries in between DHS, so during the time when the data are not collected. And now sort of like differences between the developing world and the developed world may play out in this context. I would ask maybe Nadia to briefly say something, and then maybe Jorge if he wants to add something, just like 1 minute each.
Great, thanks, Emilio. I mean, I think as Jorge brought up in his talk, you know, we have a lot of questions remaining about this type of data collection, and I think it's important for now to think of it as representing a certain subset of the population. But I do think that at least in India, which I know the best, you know, cell phone use and especially access to the type of technology that could answer surveys like this is increasing rapidly. And so I think that there are some opportunities. I think things we have to think about in terms of filling a gap with something like the DHS is survey length, you know, and really how detailed of data we could collect. You know, how, you know, what I've learned is the longer it is and the more option choices you have, and, you know, all of these things make a different and big type of impact in surveys that people are answering on their mobile devices. You know, people have to scroll or people have to type something. But that being said, one thing that we were surprised about is how many written in answers we got in our surveys. People, especially early on, were really sharing a lot of information. So I think we need, of course, we need more research to understand this better. But I do think that survey length is something we have to think about, as well as, of course, who we're reaching.
Maybe just to add to that, and maybe Jorge can say something like if something can be said about who is left out of these surveys. So for example, in the developing world, there's a lot of research that some of the panelists have done, especially on gender inequality. Like some groups are not on Facebook, and so they will be completely left out of any potential survey. So if we can sort of think about how to consider that issue. Maybe, I don't know, Nadia.
Can I just say one more thing? I definitely think that that is true, and especially, yes. That being said, for a different project, we did try to recruit young women, especially. This was a project also in India with targeted ads. So these ads of what I presented were not particularly targeted. And we did have a lot of success in reaching some high risk, hard to reach sometimes populations. You know, these are women, or, you know, younger women who might not be married. So I think that there are some opportunities, but there are missing populations for sure, which is also the case, I should say, with our other standard data collection approaches.
Yeah, so I agree also with what Nadia is saying. We also experienced something similar, such that, you know, shorter surveys tend to have much higher response rate. And so I have sort of like two general thoughts on the topic, which is, so for example, for our study, which focused mainly on Europe and the US, so we had an advantage, which was that we had high quality, you know, sort of representative data on all of these countries harmonized, right? So we just had to go to Eurostat, pick the data, and it was there for us. If we wanted to do exactly the same thing in, for example, in South America, it would have been very, very different, because, you know, categories are not harmonized in different variables. They might count things differently. And so it was, you know, the problem of high quality data for constructing post-stratification weights was really something that helped us achieve what we wanted to in such a short amount of time. But coming back to what Nadia was saying, so really what I think the component that is missing from Facebook research at the moment is, I think we really need to understand what are the self-selective characteristics of people who are on Facebook, those who are not on Facebook. And that way we can understand, for example, whether we can study a particular problem, because if that particular problem is unaffected by the self-selection characteristics, then maybe it doesn't matter and we can do it through Facebook. So really we have to sort of try and understand the differences in self-selection between countries in platforms such as Facebook and Instagram and these social media platforms.
Can I just say one more thing quickly? Another thing that we have learned is that it's not just who's on Facebook, but who answers surveys on Facebook. And our understanding of the algorithm that Facebook uses is that not only that it specifically targets people with ads who they think are likely to answer our survey. So it's even more sort of narrow and complicated to understand who's getting the ad and how those people even differ from Facebook users in general.
Yep. Thank you for your comments to the both of you. I see in the Q&A that there are some questions about sort of ethical issues and so on, privacy ethical issues. So maybe I would like to ask a question to Ingmar this time. So this is a broader question that picks up on the questions from the Q&A. You showed that Google data, in a way, is a black box. We don't know exactly how they collect the data, but it could be useful, especially to NGOs and local authorities, even though in some situations that information could also be misused by local authorities. And so I would like maybe to ask you if you could elaborate on that, on sort of like ways to ensure that the data is preserved and used in the right way. Maybe also one other thing is that you showed that it takes quite a bit of work to collect this data, and this data could potentially be made available by Google with information about what the data is and with some sort of documentation. And since you've been sort of like, you've had one foot in the industry before as you worked at Yahoo, and then you have one foot in academia, so you know both worlds. And I would like maybe to ask if you can elaborate a little bit on that, on the sort of like constraints that these companies have, commercial or privacy issues in terms of data, but also like what should we reasonably expect from these companies?
Sure. Yeah. So okay. So let's start with sort of the ethics, and there's, let's say, there's the mechanics of ethics, and then there's the actual ethics. So what do I mean by the mechanics of ethics? So this would be like the IRB sort of, right? So getting IRB for this sort of work, we've never had any issue because it's all anonymous, aggregate. You don't have any personally identifiable information. I'm not about the survey. If you want to run a survey, of course, then this also depends on what sort of questions you're asking. But I'm just sort of talking about just getting sort of pre-aggregated data of that. So as such, we never had issues with getting IRB where it was sort of needed. But that doesn't mean that there are no ethical issues around this. So one of the things that I think that's sometimes overlooked is not around privacy, but around group harm. So what do you mean by sort of a group harm, right? I mean, you can go to these platforms and let's say, men who are interested in meeting men, or I don't know, or people who are interested in Jewish holidays living in Germany, right? And you could sort of draw a map of where in Germany, people are more or less likely to be interested in Jewish holidays, right? And if you know anything about German history, right? And I mean, that makes me, uneasy sort of, right? And I'm German sort of, right? That you can sort of do this sort of, right? And there's no privacy evaluation there. I have no idea who these people are, right? Like sort of, so, but I could probably identify sort of towns or sort of, so where, you have more or less than expected or sort of, so you have sort of pockets of people likely to be of a certain ethnic or religious affiliation, right? And so this sort of risk is to a certain degree, this is sort of something that I sometimes worry more about the privacy risk. There's a lot of focus on privacy. I don't see privacy risk to the, much in the data that we are sort of using. It's already aggregate. You don't have individual level data, but there's more sort of this group level harm that you need to be sort of wary about, like sort of, so like how could this be sort of, abused in sort of different sort of context. And there, of course, I mean, it depends, of course, who you are personally working with, or sort of, so. And it is a bit sort of tricky. Now, sort of talking about the sort of industry and sort of, and they have, I guess, sort of similar concerns. Of course, there's there's always the PR nightmare sort of, of sharing personally identifiable information or of any sort of privacy leak. But they're also aware of how this group level harm to a certain degree, right? They are more interested or more open to if they're partnering on topics such as gender gaps or sort of, where maybe the risk for abuse is not as obvious as sort of, but when it comes to studying migration, they might be more hesitant to do so sort of, because, migration, especially let's say in the US at the moment, is a touchy, sort of issue. And, do you really want to, provide governments with better data on the topic, like sort of, it depends on which governments, right? Maybe in Europe it's okay, but I don't know if I, want to give all the governments around the world, better migration statistics and a very spatially fine-grained level or sort of, right? And so that's then where some of the, also company internal discussions would come in. So there might be more, not necessarily the source of data, but also the application of how it's used. So some applications, they might be more open to collaborating than others.
Okay, thank you, Ingmar. Maybe I'll take the occasion to maybe ask Michele Tizzoni to follow up on the question related to sort of collaborations between the industry and academia. Since you work with private data, you can perhaps share your experience, what you've learned from that process, and maybe if you have some suggestions for people who would like to embark on that process and work with cell phone data.
Yeah, thanks. Yeah, I think, of course, this has become very relevant during the pandemic. So I think, before COVID-19, it was pretty clear to everyone that mobile phone data are an important data source to understand mobility during outbreaks and can be used to inform public health responses, to understand the spread of diseases. But the industry was not really ready when the pandemic struck to really be ready to share the data and to provide access to the data, with some exceptions. And here I have to say that Cubic, which has a long track record of providing data anonymized, of course, with all the privacy safeguards, to researchers for in their Data for Good program that is now running since 3 years more now. So only a few companies were ready to tackle the challenge and understand that how the data was really crucial to work on this. So on one side, it's clear, I mean, there are still many barriers between the industry and the academics, and there's a lot of discussion on how to overcome these barriers. But at the same time, I think now, since the clear value of the data, so the value is clear to everyone, I mean, how important they are, I think there are also more opportunities for researchers. And here I still mention Cubic, which has been always very open to collaborate with researchers. So we are just one group, part of a large data collaborative, where there are more than 15 research groups working on data, on location data in different countries, and on the COVID-19 pandemic. And I think that, yeah, this is a first endeavor that will grow further in the next months. So if someone is interested to collaborate on this, also can reach me out, or also reach Brennan Lake at Cubic and to collaborate on this.
Okay, thank you, Michele. I see that there is one question from the audience, someone who wants to speak. So I'm going to allow Francisco Ro to talk. Please, Francisco, be very brief, 30 seconds at most.
Okay, thank you everyone for the interesting presentations. So I have a question for Ingmar, so about the Google data. So I got some experience using some of the Google data, and I know so that they have changed their policies recently in the way how you can use the data. So are you aware of any constraints or restrictions on how you can use the mobility data that you have collected?
Sure. So yeah, when it comes to sort of resharing, it's always sort of tricky. I mean, I'm not aware of restrictions on using it for research purposes. And there's then also, even if so let's say there's also there's a distinction between terms of service and what's legal, like sort of, right? So there have been many cases where researchers were not necessarily compliant with terms of service, but they were still found to be in line with the law, sort of, right? And so it's, let's say it's a complicated answer, sort of, right? Like personally, I don't see any problem in using the data for this research for good purposes, but other use cases I would be more hesitant about, in particular if it's for commercial use.
Thank you, Ingmar. So we are running out of time, but I would like to give all the speakers the opportunity to say something, or at least to have some reactions to some of the comments that we received via the Q&A. So first of all, I would like to allow Radie and Jelena to briefly respond to any questions they might have received via the Q&A, or potentially to sort of elaborate on the issue of sort of measuring what is very hard to measure. So you're measuring quantities like trust and misinformation. You're using different approaches. What if you could complement these approaches? Say, Redi, what if you could add digital trace data to complement your survey? Or Yelena, what if you could run a survey or an experiment to complement your study? And afterwards, I would like to ask Hugo if he can elaborate on what would be lost if we didn't have this type of data, this Google data. What if we wanted to assess the impact of non-physical, non-pharmaceutical interventions on COVID-19 and mortality? What could we use instead? And whether potentially there are ways of combining traditional approaches with these types of new data. We'll go maybe Redi first, and then Yelena, and then Hugo.
Great, thanks, Emilio, and thanks very much to everyone who's asked questions in the Q&A. You know, I've been trying to follow and respond there, and I hope I've been successful to answer Emilio's sort of general question about the scope for integrating different sources. I think really, I think, you know, to some extent we tried to do that in our study by having both looking at Twitter as a kind of public discussion around who people are seeking information from, who are they retweeting, and we also collected survey-based evidence because, you know, for social scientists, survey-based evidence is often a kind of gold standard that we aspire to collect anyway. If there's a way to combine them, for example, by asking people to actively share their social media histories within a survey framework, you know, that could be another way in which you could actually identify specific individuals and see how they are engaging with specific kinds of platforms or information sharing. And I think that could be a way to really augment the potential of and integrate those two types of information. But then, of course, this would require sort of a clear, informed consent when fielding the survey, and would also require ways to get around issues involving appropriate use of the data and how to use it would require thinking harder about issues such as anonymization and privacy. So you know, in sum, I think there is potentially a way to integrate them to sort of get different kinds of measures. But I think it's an evolving space where there's lots of exciting work still to be done.
Thank you, Redi. Yelena would like to add something to that.
Yeah, thank you. Yeah, I think that combination of resources is especially an interesting way to go forward, and especially, for example, looking at the Facebook ads library that I told you about. This basically could start several research paths because, as we've seen, there is a lot of data on mobility and how people behave, but why they may do so is an interesting question, right? So it's interesting to also do kind of a media analysis where we could see what kind of messaging is most effective to get people to change their behavior, and of course then that would propagate to the actual health outcomes. But yeah, to look at all of the media that people are consuming as much as we can, not just I guess not just Twitter, but the advertising people see, the things they might see in YouTube is also very popular for kind of alternative information on health. And I think all of these need to be taken into consideration when we're trying to explain people's behavior.
Thank you, Yelena. Now, Hugo, what could we have done without Google Mobility Report to assess excess mortality?
Thank you, Emilio. It's a good question to which I'm not sure what I can answer, because yeah, it's clear that during a crisis period like COVID-19 pandemics, or even in, let's say, smaller scale crisis, mobility, near real-time mobility data are extremely important to monitor how much the population is moving, and because it's well known that increased mobility can bring forward a higher likelihood of spreading the disease. So, well, I'm not sure. I think it's great that Google and other companies like Cubic are releasing this data. I think what would be the step forward would be to try to give additional information, always keeping into account the privacy of the users, but in order for researchers to assess a little bit better how much representative these data are of the overall population, which is not always possible. Well, yes, the use of this data, I think, has very promising features.
Okay, thank you. Thank you, Ugo. So I have many more questions, and I see that there are still questions coming, flowing in the Q&A, but we are already above, over the time limit that we have. We are 5 minutes over. So I think that we reached the end of the webinar for this time, but this is only the beginning of further conversation and exchange. So I really, really encourage you to reach out to the speakers and either via email, Twitter, or however you want, and continue the conversation. I also would like to invite you to take a look at the IUSSP webpage, and in particular, the webpage for the panel on digital demography. If you have suggestions for activities, if you want to organize something, if you want to be involved, please get in touch with one of the panels or get in touch with me. And if you have any criticisms, we're also happy to hear about those in order to do things better the next time. In general, we'll be delighted to explore any avenues for future collaboration. Now, before we end, I would like to thank all of you for actively participating. I would like to thank the speakers and panelists for their excellent presentations. And I would like to thank IUSSP for hosting the event, in particular, Tom Legrand, Mary Ellen Zupan, and Paul Monet. Now we reached the end. I'm just going to unmute all of you so that we can all hear a round of applause, and we can then end the event there. Okay. Thank you. Thank you all.
Thank you.
Thank you.
Thank you.
Thank you.
Okay. And I'm going to turn you all off in a minute, so we say goodbye.
Bye, everyone.
We're still
Bye,
on
everyone.
without attendees. Okay.
Yeah.
Bye-bye.
Bye.
Thank you, Emilio.
Thank you, Tom. Thank you, everybody.